Hi, what's up, guys? Welcome back to another interesting episode on the show Behind the Scenes in Hell with Dr. Ron. And if you're new here, I'd like to introduce myself to you. My name is Ronald. I am a medical doctor and everything around healthcare, health tech, alternative careers. And if that's the kind of stuff you're looking for, then you're in the right place. So just hit the subscribe button. To my returning viewers and subscribers, thank you guys for sticking around. Thank you for supporting the channel because without you guys, we won't be where we are today, right? So that being said, let's get into today's conversation. So, um, a lot of persons are on social media these days. People are on WhatsApp, people are on Twitter or X, people are on Instagram, LinkedIn, Facebook, Pinterest, Medium. Platforms, and people are on them for various reasons, and that does not exclude healthcare professionals. So you find doctors on social media, you find nurses on social media, pharmacists. In fact, you find every kid of healthcare professional on social media, right? But the part that interests me is what people actually do on social media. Now, recently, people are beginning to, in Twitter or X terms, chase clouds, and that also includes healthcare professionals. So recently, you're seeing cases of healthcare professionals sharing unverified information, putting out information that could harm people's life, or people promoting products that are not NAFDAC verified or scientifically proven to cure whatever illnesses. And that's a big issue because you're going against the ethics, you're going against the standards, you're putting people's lives in danger, and you're endangering your license actually, right? Because in serious crimes, right, it will be you might even lose your license to practice. So that's what I'm going to be talking about. The things you shouldn't do if you're on social media as a healthcare professional. So if you're a healthcare professional, you're a doctor, you're a nurse, you're a pharmacist, med lab scientist, technician, whatever cadre of healthcare professional and your social media, then you should wait to the end of this video or watch the end of this video because some of these tips I'm going to be sharing probably save your license for you. And if you know somebody who is a healthcare professional in your family or in your circles, you can share this with them for them to also learn one or two things, right? So let's get in. So the first don't of social media for healthcare professionals is kill the urge to share information very quickly. There's this thing about, being the first to report something, or the first saw it on my page, or the first saw it on my handle, and all of that. And that also relates to healthcare information. You know, you need to think through whatever post that is medically related before you put it out there. You ask yourself, I mean, should I really share this information? Is it worth me sharing this information? So some people will tell you think twice before you post. So you really want to think it through before you make that post because the internet never forgets. Then secondly, if you identify as a healthcare professional on social media, then you cannot be passing information that is not verified. So you need to be passing only authentic information that you're concerned about the appropriateness, you're concerned about the authenticity, you're concerned about the source, where it's coming from, and why you're sharing it. So as a rule, make sure that whatever information you're sharing on your social media pages are verified. So recently, I know YouTube they started this program where they're trying to bring in health creators, and I think I looked at the requirement list. Part of them is to you must put your license number, maybe GMC or whatever. I think they're starting in the UK and US. So you have to put your GMC number to show you're actually a qualified healthcare professional to be pushing out those sort of content out there. So it's really a big deal. So if you cannot ascertain the veracity of whatever you're showing, please don't share, right? Then the next thing is you shouldn't talk about patient or discuss patient information on any private or public forum whatever you discuss with your patients should remain with you in your consulting room, and that's the end. Right. And even if you must do that, then it has to be seriously anonymized. But I mean, for me, to be on the side of caution, I don't even talk about whatever goes on in the consulting room because you don't know what can happen. So, as a rule, do not talk about patients or discuss any patients on any public or private unsecured media spaces. Then the next one, a lot of persons use very vile words, very derogatory words, very unprofessional words, really, on social media when they identify as healthcare professionals. Now, some people will argue, yes, they are human beings, yeah, they have to live their life and all of that. But I mean, you can't be insulting people on social media as a healthcare professional. Just a minute. As a healthcare professional, because it doesn't make sense, So, as a rule, again, don't use vowel words, don't use disrespectful languages, and all of that. Then the next thing is, in the case you want to use an incident for public education, you cannot use the exact name, you cannot use the exact location, you cannot use the exact age, you cannot use the exact ethnicity, because these are patient identifiers. I mean, there are other ones, but I just mentioned this one. These are things that people could come across and they can easily identify or know the person you're talking about. So imagine it was somebody who's suffering from an illness or a condition and he wants private, and because you've shared a couple of patient identifier details, then people are able to figure out, oh, Mr. A is actually suffering from this and all of that. So you don't want to put people in that position. So that's a no-no. Then we know people fond of again, YouTubers or vloggers or whatever. They take a lot of videos of their workplaces, and sometimes they capture patients in the hospital or wherever facility they work. Patients are on admission, they are in their most vulnerable states, they're undergoing procedures or treatment or whatever, and you capture them on video, then it doesn't make sense. So if you're gonna do that, you actually need patient permission to do all of those recording and all of that. But as a rule, why should you even do that recording in the first place? So you don't want to share videos and pictures of people without their consent. Then you cannot bully or harass people online. Again, people will say, he has to live his life as a doctor or as a nurse, blah, 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 all of that. No, you have to stay professional, right? If you identify as a professional, I mean, that's what I think and that's what I try to do, right? Then lastly, you should not fail to declare any conflict of interest if it exists, especially when you're endorsing or promoting a specific healthcare product. I mean, if there are gains or maybe you own the company or you're sure getting money somewhere from that product you're endorsing, then it has to be stated clearly, because it's important as part of integrity and all of that to make sure you declare conflict of interest only where it exists. So if it doesn't exist, then there is really no big deal to talk about it, or when it does not exist. Then the last one I will talk about before I end the video is if you're promoting any healthcare product or device or whatever, you need to, what's the word now? You need to be sure of what you're promoting, because as healthcare professionals, we are sort of authority figures, right? Because you write a prescription or tell people, yes, this is going to make you well and all of that. And if whatever you're promoting hasn't been verified or are certain to do what you're promoting, then you're actually endangering people's lives and all of that. So you need to make sure that whatever you're promoting on social media is actually healthy, is actually safe, and you know can help people live healthier lives or better lives, really. So those are some of the top tips I thought I should share with healthcare professionals that are on social media for them to utilize to stay safe on social media, The internet never forgets, so you should always have that at the back of your mind. So what's your favorite one, or is there anyone I've missed? You can drop it in the comment section. I'm here watching, chatting with you. And yeah, so that's it from my own end. And if you want to reach me, drop me a comment in the comment section and I'll pick it up from there. Until I come your way next episode, I still remain your host, Dr. Ron, and bye for now.